part 1 of the I10-CM coding conventions series. Today we're going to be talking about main terms and subterms. It's a little difficult to understand the difference between main terms and subterms at first, but the more you practice, the easier it will get. If you have any questions at all, please do not hesitate to ask. I10-CM, identifying the main term and subterm. Let's start with what is a main term. A main term is a noun, and you may be asking, what is a noun? A noun names something such as a person, place, or thing. A main term is the noun that describes the patient's diagnosis or the reason for the encounter, and an example of this would be appendicitis. The main term should be abstracted from the documentation for the encounter. And to do this, the medical coder must review the medical record, find the provider's documentation for that specific encounter, and then abstract the diagnoses, conditions, or other reasons for the encounter. And then after that, they're going to locate those codes for those specific reasons, the diagnoses, conditions, or other reasons. And then those codes are going to be entered onto the claim form, and that is how the physician is going to get reimbursed. Subterms are adjectives that describe the noun. Subterms are indented under the main term, and this indicates that they pertain to the main term, and they also help identify variations of the main term. An example of this would be that there are many different types of pain. So the subterms indented under the main term pain would describe the various types of pain. Another example would be mass. There are many different types of masses, so the subterms indented under the main term mass would describe the various types or sites of mass. And as you can see on this example, which I also had on the previous slide, there is a picture on the right-hand side, and this is what it would look like in your I10-CM codebook. Mass is the main term. It's bolded, bold-faced. In the codebook, it may even be a different color. It also starts with a capital letter. Then you go down to breast. You can tell that it's indented to the right, and this would be considered the subterm. There are many different types of masses. There's abdominal, and then you have epigastric, generalized, left lower quadrant, and so on. You could also have a mass in your chest, ear, kidney, or localized. It is a good idea to scan the entire list of subterms when you're coding to understand how they are listed under the main term. There are subterms, and then there are subterms of subterms. It can get confusing, so make sure to take your time when you're reviewing the subterms just to make sure you are selecting the correct one. And because of the complexity of ICD-10-CM codes, many publishers of the codebook will include lines down each column of the index, and this will help coders navigate through all the different subterms. It's also helpful to use a ruler or something with a straight edge to help keep track of the subterms. Essential versus non-essential modifiers. Subterms are considered essential modifiers because they impact the code that is selected. The location of the pain is an essential modifier that leads the coder to assign a code different than the code for an alternate site of pain. Non-essential modifiers are words located in parentheses next to the main term of a subterm in the index. They offer additional information but do not impact code selection. So on this example, you can see pneumonia. It is about halfway down the page, and this is taken from the ICD-10-CM codebook. In parentheses next to ammonia, you'll see acute, double, migratory, purulent, septic, and unresolved. These are non-essential modifiers. So what that means is the provider could document acute pneumonia, double pneumonia, purulent, unresolved pneumonia, any of the above, and they're all going to be that same code, J18.9, or the provider stating any of those words in those parentheses does not change the code selection. Now, something that is not listed on this example is parentheses next to a subterm. However, a subterm is an essential modifier, so that's something that you need to know. So if the physician was to document allergic pneumonia or anthrax pneumonia or aspiration pneumonia, that would change the code selection. So as you can see, we will go with anthrax. It's A22.1 versus aspiration, which is J69.0. So those essential modifiers, the subterms, do change the code selection. Default codes are the codes for the unspecified version of a condition that can be easy to overlook. For example, if the coder is looking for pneumonia, unspecified, then it is not necessary to look any further than the first entry, which would be J18.9. Default codes are always listed next to the main term and represent the least specified version of that code. So this is going to be a little exercise that we do on the next few slides. So the diagnosis is acute appendicitis. What would be the noun, the main term? Appendicitis. Acute is a descriptive term. So acute is very unspecific. It would never be the main term. Acute and chronic will never be the main term. Another example, this diagnosis is bipolar disorder. What would be the main term? Disorder. Bipolar is describing the type of disorder. Diabetic neuropathy. What's the main term? Neuropathy, because there are different types of neuropathy. So for this example, diabetic is describing neuropathy. Inguinal hernia. What is the main term? The main term is hernia, because there is umbilical hernia, hiatal hernia, inguinal hernia, and so on. It is describing the type of hernia. Intervertebral disc degeneration. This one's a little bit tricky because there are 3 words, but think about it. What words are describing the noun? Degeneration. So intervertebral disc is describing the type of degeneration. Thanks for joining me today. Make sure to watch part 2.